In this PowerPoint, I'm going to be presenting Advancing Patient Care at ABC Medical Center, which is located in Edison, New Jersey. ABC Healthcare Organization, as stated, is in New Jersey. It's a 400-bed hospital. It has a pediatric and a main ER, a rehab unit, outpatient facilities in the nearby area, and it is known for their specialty in neuroscience and neurosurgery as well. They're also in the process of becoming a magnet hospital, which is a very high ranking involved with nurses. So that means that most your nurses that work for your organization are extremely happy and they have a bachelor's degree or higher. In ABC Health Organization, the current issues that we're facing is patient frustration with patient charting and medical records, duplicate testing due to the inability to access medical records, lack of follow-ups from nurses and physicians, lack of communication among specialties, lack of supplies, delayed results, inability to view results, an outdated facility, poor follow-up care after discharge, staffing concerns, and minimal parking. In this facility, the main ways of paying is charity care, Medicaid, and private insurance such as PPO, FMO, HMO, POS, HD. Charity care you can apply for when you come into the hospital. It's also important to understand that in a hospital such as this, we follow EMTALA, so this means that we do not turn any patients away, whether they can pay for their services or not. We take care of everyone. So, proposed solution to this frustration that patients are facing with their repeated testing and their inability to view the results is to implement an EHR system such as Epic. Epic is widely used across many healthcare networks, so it would make it very feasible for a patient to receive care across all these different networks rather than having to stay in one network specifically. The benefits of having an EHR system such as Epic reduces the duplicating lab results and imaging, which is very costly on an organization, and it can also be costly for a patient if their insurance doesn't cover it. So implementing an EHR system makes it easier for continuity of care as well, like I said before. So if one patient wants to get care within one healthcare network, they don't have to repeat testing, and other physicians could just go into their electronic chart and see what they've had done, what lab results they have, what imaging they have done, and see it in real time. This is also great for a patient because they can see what's going on their phone, on their laptop, and it's also encrypted so no one else can get inside their chart without their username password. So, EHR systems improve the quality of care because patients don't need to bring paper records to every healthcare appointment. And this is also dangerous because if you drop your paper records, other people can have access to your healthcare information because it has your date of birth, your MRN, your lab results, and everything that's going on with you. So it ultimately improves efficiency for the healthcare system and the patient. So the role of public policy in terms of healthcare services. So public policy consists of laws, regulations, guidelines, and actions stated in addressing relevant and real-world problems, and it includes implementing programs such as an EHR system. So this can be involved in public policy because it improves healthcare and it makes it more efficient. However, as everything else in the world, you have to make sure that you abide by guidelines such as HIPAA and the HITECH Act. HIPAA is very important. It's something that you hear often in the healthcare industry, and this involves keeping patient information very confidential and making sure it does not get in the hands of the wrong person. So public health policy plays a crucial role in electronic health systems because its ability of EHR systems to improve the continuity of care, and because the lifespan is increasing in the world and chronic issues are becoming more apparent, it's important that there is a good trail of electronic records of what the patient has received in the past, as well as what they need to have done, and what in the timeline of their lab results, whether they're getting worse or whether they're getting better. So chronic disease self-management is an important aspect of tertiary prevention, whose goal is to achieve a return to maximal function and has only recently become part of an urgently public health policy. And this was by Gauthier, Beaupre, and Kuzimski. So the relevance of the current financial data in terms of the projected outcome of the project. So ABC's current financial standing is the next fiscal year is plus 5% to 10% of the most recent total. This past year, they've seen about 1.5 million patients, and their current budget for the implementation of the new system is $2.25 billion. So the cost of implementing Epic, a new electronic health recording system, is not the most costly. It really depends on who they want to launch the system with initially. But if the adopted EHR implements visual aids, a provider portal, or in a rigorous decision supporting tool, adoption can significantly reduce the incidence of duplicate labs and imaging testing, which can save the healthcare organization a lot of money. Because duplicating labs and imaging and repeating labs that are unnecessary due to losing records is an extremely high cost for organizations. So this can be a really great source of saving the organization money. So some downfalls though, however, is there is a huge learning curve for staff. So electronic charting is something that has to be taught. So there needs to be education provided, whether you do classes during their shift or you do classes outside of their shift. But either way, you're still going to have to pay staff to learn all this extra stuff. Additionally, increased patient concern can be an issue. So if a patient goes into their portal and they see things that are marked as abnormal, they might immediately call their doctor, immediately book an appointment with their doctor, and see their physician just to make sure everything looks good, even though the labs may not be abnormal in the sense of concern, but abnormal in a acceptable way. Additionally, system downtime can delay care. So if nurses can't chart, they'll have to use paper charting, and that could delay care by slowing down their work process. The system can glitch, and as well, like anything in healthcare, there can also be hackers. But the benefits are, as stated before, decreased duplication of test results, it streamlines continuity of care, and also improves billing through the ability to use ICD billing electronically, and also you can keep track of new health trends, as well as make sure that the ICDs are billed properly. So electronic health records such as Epic make it much easier to bill patients and keep track of the billing. And that's ultimately everything that I have for implementing an EHR system.